Okay, we're recording. I'm recording the audience.
Providing audio.
Well, hold on. I'm trying to. Here's me.
Where's the dog going?
I don't know.
She
She
doesn't wanna
probably
listen.
went outside. Who knows what she wants? Okay, I think you're good.
I don't know about that, but I'm ready, I guess. You guys ready? Remember, you guys are supposed to be like healthcare professionals, so listen to it kind of in that capacity. Okay. Today I'm going to talk to you about hospital hygiene, mostly, hand hygiene, and hopefully convince you that alcohol-based hand rubs and stuff are the way to go to help improve compliance for hand washing. Did you know that according to Persuasive International Journal of Nursing Practices that 1 in 10 patients that are admitted to a hospital acquire a nosocomial infection while there? So basically an infection while they're in the hospital. And did you know also that nearly half of those could be prevented if better hand washing hygiene practices were put into place? Studies have shown that hospital-acquired infections were in many cases just caused by nurses going room to room without washing hands between patients. I mean, it seems like a simple practice, but people get busy and forget to do it, and that's the way we spread a lot of bacteria throughout the hospital. In studies, they have been shown that even though that washing hands between patients is basically standard operating procedure, that people don't follow it, and it's only actually adhered to about 40% of the time. Now we all know that we're not trying to not follow rules or anything like that, but there are several reasons why healthcare professionals don't adhere to these rules, and some of those cases it's just workload. That they got too much to do and they don't feel like they can do it. In other cases, sink locations, and this is another thing we'll touch on in a minute, sink locations, they're not convenient, so they just basically don't do it. Sometimes too much soap and water can cause skin irritations and things like that. If your hands are not visibly dirty, they'll think they can just bypass it. And a lot of times, they just don't feel like they have time. They just have way too much going on, and they don't feel like they have time to do it. Here's another thing what I was talking about as far as the sink locations. Right here you can see that there's 2 IV pumps in front of the sink, and it's on the other side of the patient bed, so I mean the odds of that nurse using that sink before they leave are not very good. So it just basically location is a real problem. There's several ways that patients or healthcare professionals are exposed to the bacteria, and some of those are just pulling patients up in the bed, taking vital signs and things, touching patients' hands, touching their heads, to help turn them over in bed, touching their gowns, touching their bed rails and their tables that go over their beds, touching the IV pumps. I mean, there's several things that they can do that they can pick up that bacteria, and we don't even realize we do it. Some of the advantages of using the alcohol-based rubs, they take less time. I mean, we all know that we don't have enough time, so I mean, it taking less time is a huge factor. They're easier to make accessible. You can put them anywhere. Skin irritation and dryness is greatly reduced by using the alcohol-based rubs. They actually reduce the number of bacteria better than soap and water, and that's a big one. They've also proven to improve compliance, and I think that's a lot of it because of how convenient they can be located. So that's a big one. Actually, the CDC has come up with guidelines saying that they recommend using alcohol-based hand rubs, and that's a big one. That's a reason in itself. A lot of people wonder, will using the alcohol-based hand rubs dry out my skin? Well, the answer is really no. There's been studies done that say that actual nurses that do the soap and water, they actually have more of a problem with that than people that use the alcohol-based rubs. There's actually conditioners in today's alcohol-based rubs that help reduce the drying effects of the alcohol. They've also found that it's a lot faster, it's more practical to use the alcohol-based rubs. They did a study and it showed that it would take about 62 seconds for a nurse to go to a hand washing station, wash their hands, and return to the bedside. Whereas the same study in the same facility showed it was an average of about 15 seconds if they used the alcohol-based rub and got back to the bedside. So I mean, that's a huge time saving. Studies have shown that they've actually reduced, it's been more than 20 studies, I'm sorry, more than 20 studies have shown that they've actually reduced bacteria more than using antibacterial soap. So I mean, that's a clear show to the level of effectiveness of an alcohol-based hand scrub. Some of the ways that we need to work on doing it in a way with the problems that we have with keeping ourselves in compliance with hand washing is we need to make it quicker and easier, less irritating for the skin in order to improve our compliance. I mean, if it's simple to do, people will do it. If it's on their way to somewhere, people will do it. And that's one of the things we really need to focus on. They've done studies to show that if there are dispensers located in a prime area, that people do it. I mean, if you figure when you walk into the patient's room, if it's somewhere between right outside the patient's door all the way up to their bedside, well, you got to pass that twice. Once on the way in, once on the way out. I mean, it should easily improve your compliance because you got to walk by. You don't really have an excuse not to do it. A lot of people are asking, should I still practice regular hand washing procedures? Well, sure you should. I mean, there's times when regular hand washing procedures should be followed. I mean, some of those times are if your hands are visibly soiled, if you have body fluids or blood on them, if you're getting ready to go eat a meal, or maybe you're coming back from the restroom. These are all times you're still supposed to follow all those guidelines. But in order to, again, the compliance deal, I mean, that's our biggest factor is we want to keep people from acquiring infections from us. Any way that we can control the transfer of bacteria from person to person, that's part of our job. So you still need to use the regular soap and water hand washing, but the alcohol-based hand rubs, that's just an extra precaution. It's simple to use. You put between 1.5 and 3 milliliters in your hands. You rub your hands together, covering all the surfaces. Get underneath your fingernails best you can, around your fingernails, and you basically just rub your hands together until they're dry. Now that should take about 10 to 15 seconds. If it takes less time than 10 to 15 seconds, you probably need to use a little more of the cleaner the next time. But that's basically the gist. 10 to 15 seconds is basically a pretty good rule of thumb. So, I mean, I think we can all agree that as healthcare professionals, that we need all the tools that we can get to do our jobs, whether it be the latest in medical technology or all the way down to the things that we use to clean our hands. Our job is to keep the patients safe and healthy or get them back to health. And this is one of those. I mean, the bacteria is a big battle that we fight every day, and the alcohol-based hand rubs, I think, could be a powerful weapon in that fight. Thank you very much. Hey, shh. No noise over there. Betsy, how do you shut this thing off?